Again, getting rid of the insurance industry would be a huge value to the system, because basically we need money to fund the system. We need providers to do the care. We need prescription drugs. We need certain things. But basically, if we have those things, you don't need a whole bunch of different payers to pay that. You can basically funnel that through one payer and pay for, because really what we have now, you use the example of paying for something at the store. What we have is, it would be like going into a grocery store and everyone paying a different price for a gallon of milk with different currency. Imagine how many people you need behind the counter versus one price, one currency. And that's essentially what a single payer would do. So that's just in terms of the financing. But as Michael was saying, we also need to have a system of looking at what are the needs of the population and what are the services available and what ones do we need less of and what ones do we need more of. And we don't have that, and other countries do. So the combination of things, they spend much more on primary care, they have more primary care practitioners, less specialists. And again, we have the opposite.
But they have better health outcomes, don't they?
And better health outcomes. For the reasons that Michael mentioned, there are places in this country. I have a friend that lives in Philadelphia who was telling me that there are virtually no primary care doctors anymore. People go to the emergency room for everything. They go to a specialist. They have a mole on their arm, dermatology. They have high blood pressure, they go to cardiology or nephrology. All those ologists cost way more than a primary care because they do more testing. It's not that they're not necessary, they are, but they aren't necessary as frontline care. We're talking about frontline services.